If I could pass this around to Ms. Gertrude. I extend greetings to all board members, affiliates, and the general public. First, let me thank each of you for your prayers and support during my brief illness. I am on the way back to good health. I am following my doctor's orders, and indeed will be having our own physician here, Dr. Tuck, will be my general practitioner. So we are looking forward to rebuilding that and working for full recovery. I'm looking forward to our first annual board retreat that will enable us to continue the Macon County Healthcare stride toward providing quality health service to the citizens of Macon County. In doing so, the infrastructure of Macon County Healthcare Authority is very important to achieve the very best for our citizens. It is a parallel walk in development, and my report consists of the following. The first is the annual board retreat. You have been presented with a draft agenda and logistical updates. The retreat will begin at 7:30 a.m. with breakfast. And Mr. Lee will then give us again the manner in which to get to the board room. It's going to be held at Tallahassee Hospital's boardroom. And you said, Mr. Lee, that's on the third floor?
Third floor. Administration doors are on your right.
They are going to provide a continental breakfast, juices and water throughout the day, and a lunch, okay? They will also provide within the room, and we're working out the logistics of that, whether we will be able to do a Skype conference with our bond attorney from New York, and any LCD projections that we will do. We do have a PowerPoint that we want to present to the board, and so those items will be within that boardroom. If you look at your, well, before I get to that, let me report on the pre-retreat questionnaire that was sent out. I sent that questionnaire out, and the results of that questionnaire was as follows. The first question was, what are the 3 to 5 major issues facing our organization in the next 5 years? The general answer was the board needs to develop a plan for extended hours of health care services, funding support from each other, the community and leaders, and working on the infrastructure of the authority. The second question was, what are the 3 to 5 major issues facing the board in the next 5 years? Setting our goals, getting the public and politicians on board, full teamwork, staying focused on our goals once set, and understanding the function of the board. Question number 3 was, what are some suggestions for ways that we can better serve our clients and members? The general answer was communicating, being available and open for suggestions, transparency, being able to agree to disagree, and one survey did not answer this question. The next question was, please rank the following proposed goals for this year's retreat in order of importance, 1 being most important for the board to achieve at this time. Ranked number 1 was to understand the challenges facing our organization in today's environment. Ranked number 2 was to discuss strategic directions our organization should take in the future. Ranked number 3 was to discuss the relationship between the board and executive staff and how the relationship should be improved. Rank number 4 was to evaluate the board's performance and identify areas for improvement. There were no other suggestions on either of the return questionnaires. The next question was, please rank the following proposed retreat topics in order of importance, 1 being the most important. Ranked number 1 was board management roles, relationships, and communications. Ranked number 2, a clear sense of the organization's programs. Ranked number 3 was community relations issues facing the organization and board. Ranked number 4 was the board's role in fundraising. Ranked number 5, the organization's progress in achieving goals from our last strategic plan. Ranked number 6, the recent changes in environment in which our organization exists. And ranked number 7 was changing needs for our traditional constituents. There were no additional topics added. The next question was, of the proposed topics listed under number 2 above, which 2, in your opinion, should receive the greatest emphasis at the retreat? Number 1 was board management roles, relationships, and communications. And 2 was community relations issues facing the organization and board. Should the retreat include outside speakers? If yes, who do you believe would be appropriate speakers for the retreat? There were no suggestions made on any of the surveys returned. And number 4 were other suggestions for this year's retreat. And some answers were development of a strategic plan, what does each member bring to the board, knowledge of healthcare industry, experience in healthcare planning, and experience in healthcare management. That completed the survey results. And are there any questions about that, or anything that anybody wanted to add to their questionnaire? I purposely do not know who sent in what survey, because I didn't put a place for you to put your name, so it was just submitted, so I can't address it individually unless one of you have something that you want to say.
Can I say maybe one other thing that we should add in number 4 if possible, is that to form a grant research committee. We can do that.
The first preliminary session is to go forward retreat, and that's when we will review the purpose and the goals for the retreat, and we developed those in the early outset. The board orientation and development is day 1. I have asked Ms. Gabby Modesti to be there to help us with writing on flip charts and stuff. Because I'm not a good flip chart writer.
And I want to apologize for not being there now too. She couldn't get off the work.
Okay. So she's going to be there to assist us in that manner. She is not there to do any official recording. She's just there to help us with facilitating the meeting. Okay. We have at 8:30, and these times may fluctuate, they are not in stone, but we have, beginning at 8:30, a presentation. Now, we do have Mrs. Patricia Clay down, however, she informed me this morning that she will not be able to present at the retreat because she will be out of town in California at her niece's wedding. So she said that she would be more than happy to come to present to us in the future whenever we would like her to after this retreat, but she will not be there for the retreat. However, Ms. Cindy Tompkins will be there presenting on behalf of Community Hospital, and we're asking Mr. I keep want to call you Haynes, and I know your name is Haynes.
Kurt Barrett.
Kurt Barrett. Mr. Barrett to come and present to us. Mr. Eric Love is going to present to us, however, he cannot do it on Friday. He has a conflict and he will be presenting to us on Saturday morning. Are there any other presenters or individuals that you would like to see? Oh, I'm sorry. We tentatively have presentations coming from Dr. Webb at Tuskegee University dealing with grant writing, and Miss Tiffany, I did not get Tiffany's last name, but she is with SCAD, which is the South Central, thank you, South Central Alabama Development Corporation, and she's going to present to us how she can assist us with grant writing and searching for grants and what we can do in that area. So we're waiting to see, we're waiting to see whether Tiffany will be available to present on Friday or whether she will present on Saturday. From that, we'll have board structure and operations, vision, mission, and legal obligations, and we will break for lunch. And then after that, we would do a self-assessment and board development, which is SWOT. How many of you are familiar with SWOT? Okay. SWOT is an analysis that you do on your strengths, weaknesses, opportunities, and threats. And I think that we should do a SWOT analysis of the board, and then we can move forward in our direction on how to develop that. And I have a presentation that we will work on that with. Okay, and then we will have a break, And we have the opportunity we're working on developing a Skype with our bond attorney from Bank of New York to present to us on the status of where we are with our bond, the health of our bond, what our opportunities are with that, and to explain to those board members, including me, that are new and not up to date on what the bond issue is about. We're going to try to develop that, and we're trying to do that with Mr. Lee Martin, but we have not worked that completely out, so I'm not sure whether he will be able to do it or not, but it will be on the final draft of the agenda when we get it.
Madam Chairman, can I ask you a quick question? You want Lee Martin to be on the, when you say bond attorney, is that Lee Martin that you're?
I think that's
Okay, I thought you said when you said in New York, he's actually in Birmingham.
Oh, is he in Birmingham?
He's in Birmingham,
Okay.
That's what had me before.
Okay, well, okay. But I am talking about Lee Martin.
Sure, okay.
And then we would go into developing our specific goals and objectives, and then we would close down for Friday. We would reconvene on Saturday morning with breakfast again. And then this will be mostly a working day, except for the two presenters that we're going to have. We're going to work on bylaws, policy, programmatic outlook, and strategic outline. And in that sense, I'd like to clarify one thing. The board retreat is not, we will not be doing any official business at the board retreat. So any recommendations that we make or suggested, they will have to be brought back to a full regular business meeting and then be acted on. So there won't be any voting or anything like that done. If we're going to look at any changes to the bylaws, I have given some examples on how that will work that I think would be most efficient for us. And the one is, we would, at the retreat, I'm going to have the bylaws listed by article, and then some lines up under it if there's anything we want to change in that particular article. Okay, and then if there's nothing changed, that's fine, but if so, we could come back, have it typed up, and come back to the regular meeting to do those amendments, and they would be in a proper order. And I will add to the bottom of this page the address and how to get there, the third floor. My second item is funding opportunities. We're reviewing several grant possibilities from the state of Alabama, which we talked about earlier, and which SCAD is going to come to our meeting to talk about. And we're currently working with Dr. Webb at Tuskegee University to review funding sources and ideals. And one example of a grant we're going after is the 2014 Healthcare Pipeline Project. And we're going to get more details on that at the board retreat. We're also looking for funding to extended hours. We do have a physician that's interested in doing that. They're excited about the partnership we're looking to do with the ambulance service. And so I think holistically, we will be moving forward with a lot of services. And I think it's going to hit all at once. It seems like there's nothing happening right now. But when it starts hitting, it's going to start rolling like a snowball downhill. So all you want to be prepared. At this time, that concludes my report as chairman. And this report is for information only, and a copy has been provided for the records. Are there any questions about the financial report? If there are no other items on the agenda for discussion, the chairman will entertain a motion to adjourn.
So moved.
It's been moved and, wait a second?
Second.
It's been moved and properly second that this meeting of the Macon County Healthcare Authority be adjourned. So be it.